The men's sexual health clinic at Brigham and Women's Hospital is geared toward men with all kinds of sexual problems. I primarily am interested in patients with erectile dysfunction, ejaculatory dysfunction, and so forth. The main cause of erectile dysfunction is vascular, is blood flow issues. And those are common in aging men in general. High blood pressure, vascular disease, cardiovascular disease, peripheral vascular disease, all the kinds of things that affect aging, both men and women. So that'd be number one. There are some other things that can directly cause it that are the results of certain surgical procedures. For example, men who have prostate cancer and have had radiation or surgery, some of those men will have difficulty with erections. Patients who've had colon surgery, some of them. But the main cause is vascular. In general, a man who's complaining of difficulty either obtaining or maintaining an erection will be treated with an oral agent. But there are many primary care docs who don't feel quite comfortable prescribing those. But those that we obviously do in our clinic, and those would be a first-line agent for men. But they don't work for everybody. They work for probably, I would say, 50 to maybe 70% of men. All erectile function is geared around blood flow. And so anything that improves blood flow to the penis will enable an erection, if you will. So when the oral medications, whose job is to improve blood flow systemically, meaning the man takes a pill, it improves blood flow to his penis. And when they don't work, we'll try to deliver something directly to the organ. The traditional way to doing that has been with a needle. Now, it's scary sound, and men may initially be afraid of that treatment option, but it's a very effective treatment option. I'll encourage most men to try it, and if it's not satisfactory, then there are some other options. There are intraurethral agents, meaning things that you can gels that you can place inside the urethra, which is the tube you urinate from. A little bit easier, still slightly invasive, but effective. And then finally, there are surgical options, penile implants or penile prosthetics, which I don't encourage men to think about as an initial treatment option. But for many men, it's very satisfactory. It just involves a surgical procedure, and so we would generally reserve that for men who have tried other options and been unsuccessful or really unhappy with them. About 10% of men who start with other treatment options but find them unsatisfactory will eventually end up having a penile implant, and 95% of those men are happy with them. Not all sexual dysfunction in men is fixed with a pill or a shot or an operation. In a lot of men, the problem is a psychological one. Now, it isn't to say that that they have psychological problems, but I tell patients all the time that the most important sex organ they have is not below their waist. It's sitting on their shoulders. If I have a 60-year-old man who's had pelvic surgery, I know what the cause is. I know that it's not likely to be anything psychological. But if I have a 25-year-old man was sexually functioning well until a year ago, and now because of a variety of different life circumstances, he's not doing well and he has no other health problems, that's much more likely a problem that can be dealt with by a sex therapist. having access to really good sex therapists, which we do here at Brigham and Women's, is a real benefit. I think the future of men's healthcare is a wider, multidisciplinary approach. In the past, if you had sexual dysfunction, erectile dysfunction, you went and saw a urologist. If you had a cardiovascular problem, you would go and see a cardiologist. You had a diabetes problem or other hormonal issue, you'd go to see an endocrinologist. We're trying to bring together all of those specialties. Now, we actually have them under one roof at this institution, but not in a place that men can directly access. And that's what we're trying to achieve.